Most people believe high blood pressure is simple: cut back on salt, take your medication, and everything will fall into place. That's the story you've been told for years, and I understand why it sounds comforting. It makes the problem feel manageable, predictable, even under control. But after 3 decades in cardiac surgery, I can tell you something most people never hear. It is not that simple. I have stood in operating rooms and looked directly at the inside of human arteries. I have seen vessels that were no longer soft and flexible, but thick, scarred, and rigid, like old rubber that has lost its life. And what's most disturbing is this: many of those patients had normal numbers on paper. Their blood pressure was being managed, but underneath their cardiovascular system was slowly breaking down. So if you think this is just about salt, you are missing the bigger picture. I remember one patient very clearly. He was in his late 60s, disciplined, responsible, the kind of person doctors like to describe as compliant. He took every pill exactly as prescribed, never skipped a dose, never questioned the routine. His blood pressure readings were considered acceptable, even stable. On the surface, everything looked under control. But during surgery, when we finally saw what was happening inside his body, the reality was very different. His arteries were inflamed, thickened, and stiff. They had lost the natural elasticity that allows blood to flow smoothly. His heart had been working harder for years, compensating silently without any warning signs he could feel. After the procedure, he asked me a question that stayed with me. He said, "If I did everything right, why did this still happen?" The truth is, high blood pressure is not just a number problem. It is not something you solve by chasing readings on a screen. It is a signal, a warning that multiple systems inside your body are under strain at the same time. Your arteries are losing flexibility. Your cells are struggling to produce energy. Your hormonal balance is shifting, and inflammation is quietly building beneath the surface. When you only focus on lowering the number, you may calm the signal, but you are not fixing what is creating it. And that is where most people get stuck. Over the years, I have treated thousands of patients with cardiovascular disease, and I have seen patterns that go far beyond what standard guidelines address. Medication is essential, and I prescribe it when it is needed. But I have also seen its limits. I have seen patients whose numbers improved while their underlying condition continued to progress. I have reviewed imaging, lab work, and surgical findings that told a deeper story than any single reading could show. That is why I do not rely on numbers alone. I look at the system as a whole, because that is where real change begins. To understand what is really happening, you have to look beneath the surface of that single number on your blood pressure monitor. Blood pressure is not created by one isolated factor. It is the result of several systems working together at the same time. Your blood vessels need to expand and contract smoothly. Your heart must generate enough energy to pump efficiently. Your kidneys regulate fluid balance, deciding how much sodium and water to retain or release. And your hormonal system, particularly the renin-angiotensin-aldosterone system, constantly adjusts how tight or relaxed your vessels should be. When these systems are in balance, your blood pressure stays within a healthy range without effort. But when even one of them begins to fail, the others are forced to compensate. Over time, that compensation creates strain. One of the most overlooked factors is chronic, low-grade inflammation inside the arterial walls. This inflammation makes the vessels less flexible, more rigid, and more resistant to blood flow. At the same time, many people experience a decline in cellular energy production, especially in the heart muscle, which forces the heart to work harder to maintain circulation. Add to that mineral imbalances like low magnesium or inadequate potassium, and the system becomes even more unstable. What you end up with is not a simple pressure issue, but a complex breakdown of coordination inside the body. This is where we begin to address the system itself, starting with one of the most important and most overlooked elements, magnesium. Magnesium plays a direct role in how your blood vessels behave. It acts as a natural calcium channel regulator, helping prevent excess calcium from entering the smooth muscle cells that line your arteries. When too much calcium enters those cells, the vessels tighten and constrict. Magnesium does the opposite. It signals those muscles to relax, allowing your arteries to open and blood to flow with less resistance. The problem is that a large percentage of adults, especially over the age of 60, are deficient without ever knowing it. Standard blood tests often miss this because most magnesium is stored inside cells, not in the bloodstream. When levels are low, your vessels remain in a constant state of tension. Restoring magnesium does not force the system. It gives your body what it needs to return to a more natural, relaxed state. The next piece of the puzzle is inflammation. And this is where omega-3 fatty acids come in. Your arteries are living tissue, not passive pipes. And like any living tissue, they can become inflamed over time. Chronic inflammation makes the vessel walls thicker, stiffer, and less responsive. Omega-3s, particularly EPA and DHA, have been shown to directly reduce this inflammation at a cellular level. They help restore flexibility to the arterial walls and improve how those vessels respond to blood flow. This is especially important for systolic pressure, the top number that tends to rise as arteries lose elasticity with age. But quality matters. Oxidized or low-grade fish oil can do more harm than good. When used correctly, however, omega-3s support a fundamental shift in how your vascular system functions. Now we come to something most people have never been told, especially if they are taking cholesterol medication, and that is coenzyme Q10. CoQ10 is not just another supplement. It is a compound your body relies on to produce energy inside every single cell, particularly within the mitochondria. Your heart, which beats over 100,000 times a day, depends heavily on this energy supply. When CoQ10 levels are low, the heart has to work harder to maintain the same output, and that added strain contributes directly to elevated blood pressure. Here is the critical part. Many commonly prescribed statins reduce the body's natural production of CoQ10 because they block the same pathway used to create it. So while the medication may be helping one aspect of cardiovascular health, it may also be quietly depleting the energy your heart needs to function efficiently. Supporting CoQ10 levels helps restore that balance and allows the heart to work with less strain. At the same time, we need to look at the hormonal control system behind blood pressure, and this is where vitamin D plays a much larger role than most people realize. Vitamin D is not simply a vitamin. It functions more like a hormone, influencing how your body regulates fluid balance and vascular tension through systems like the renin-angiotensin-aldosterone pathway. When vitamin D levels are sufficient, this system stays more controlled and balanced. But when levels drop, which is extremely common in older adults, that system can become overactive, causing blood vessels to constrict and fluid retention to increase. The result is higher blood pressure that seems to appear without a clear cause. Restoring adequate vitamin D levels helps calm this internal signaling system and brings the body back toward equilibrium. Finally, we need to talk about balance. And this is where potassium becomes essential. Most people have heard that sodium can raise blood pressure, but very few understand that sodium does not act alone. It has a direct counterpart, and that counterpart is potassium. Your kidneys are constantly regulating fluid levels in your body, and potassium helps signal them to release excess sodium and reduce fluid retention. When potassium is low and sodium intake is high, that balance shifts in the wrong direction, increasing blood volume and putting more pressure on your succus. But this is where caution matters. Unlike other nutrients, potassium is not something you should supplement blindly. If kidney function is impaired, excess potassium can build up in the bloodstream and create serious risks for heart rhythm. That is why the safest approach is to prioritize whole food sources first and only consider supplementation under proper medical guidance. What you begin to see when you step back is that none of these factors operate in isolation. Blood pressure is not driven by a single switch that you can simply turn off. It is the result of multiple systems interacting at the same time. Vascular tension, inflammation, cellular energy, hormonal signaling, and mineral balance are all part of the same network. When one is off, the others compensate. When several are off at once, the system becomes unstable. This is why addressing only one pathway often produces limited results. But when you support all of them together, something changes. The effect is no longer small or incremental. It becomes cumulative. Your arteries relax more easily, inflammation decreases, your heart works more efficiently, and your body regains a level of balance it has been missing for years. That is the moment most people never reach because they are only shown part of the picture. So the question becomes, what do you actually do with this information? The most important step is not to rush out and try everything at once. Start with clarity. Ask your doctor for a basic set of tests, including vitamin D levels and kidney function. These two alone can tell you where your biggest gaps may be. From there, build gradually. Focus on improving one area at a time, whether that is restoring magnesium levels, increasing omega-3 intake, or adjusting your diet to support better mineral balance. Keep your physician involved, especially if you are already taking medication, and track how your body responds over time. Real change does not come from quick fixes. It comes from consistent, informed decisions that support your body as a whole. I have seen people in their 60s and 70s who believed their blood pressure was simply something they had to live with, something that would only get worse over time. They had accepted it as part of aging. But I have also seen what happens when those same people begin to support their bodies in the right way. Not perfectly, not overnight, but consistently. Their energy improves. Their numbers begin to shift. And more importantly, their confidence returns. They realize their body is still capable of adapting, still capable of responding. That is something no chart or prescription can fully capture. Your cardiovascular system is not fixed, it is responsive, and even now, it is paying attention to what you give it. So here is what I want you to take with you. Do not ignore this. Do not assume it is too late or that nothing can change. Take one step this week. Schedule the test. Ask the question. Start the conversation with your doctor, because managing blood pressure is not just about avoiding risk. It is about protecting the quality of the years ahead. And everything I have shared here is meant to inform you, not replace medical advice. Your situation is unique, and your decisions should always be guided by a qualified healthcare professional.